put your masks, if you're going on a trip, in your carry-on bag because you don't need them tomorrow, but you might need them on the way back. The CDC says it's going to appeal a court ruling that got rid of masks on planes, trains, public buses, and the like. So what happens next? What can we learn about how this appeal is filed? We bring in May Davis, former attorney in the Trump White House. All right. Put the politics aside. Judges are supposed to deal with the law. And as we understand this, it comes down to exactly how you interpret the word sanitation, believe it or not, as to whether the CDC can actually do this on planes.
That's right. And that's one piece of the law. There's the judge ruled that it was illegal on two other grounds as well, that it was improperly promulgated, not just illegal based on the law. But you're right. So the law has two sections. One is about sanitation, fumigation, inspection, things that you basically do with things, not people. And that's the part that CDC was trying to say applied to mask mandates. Then there's a whole section that applies to people. It says you can quarantine them, you can detain them, but if you're going to deal with people, there's a bunch of other hoops that you have to jump through. So that's why CDC didn't use that. So the judge basically said, you're treating people like things. You're treating them like things you can sanitize, things you can disinfect. And that's illegal.
All right, so the Department of Justice has to appeal to the 11th Circuit Court of Appeals, relatively a conservative circuit, as opposed to, say, the 9th Circuit out in California. They've got two choices. One is just to appeal. The other choice is to ask for a stay, an emergency stay, that is, that would allow the CDC to put their mandate back in place. What is, and since you've been in these discussions, what's going on at the White House right now in the DOJ to decide which of those two avenues to go forward on?
Well, you know, I'm not a big fan of this policy, but if I was in the White House, I would 100% say you need to seek a stay, and they needed to seek it yesterday, because there's absolutely no way you can ultimately win and ultimately say that public health requires masks if you let it sit for weeks and weeks and weeks without seeking this emergency relief. So for us, when we had an injunction in our Remain in Mexico policy, immediately before the injunction even went in place, we were asking for a stay because we knew that there would be a flood of migrants to the border. So we needed to do something. If you don't see that passion, if you don't see them appeal and seek a stay immediately, then the judges reading the case will know the jig is up. This isn't about public health. So
can the fact that the White House waited effectively 48 hours to announce that this was going to be appealed sort of be used against the DOJ and the White House in court?
Absolutely. So if I was the plaintiff, I would say they waited this long. That means that they don't take their own argument, their own public health argument seriously. And that's exactly one of the arguments that was used in the OSHA vaccine mandate case. In the case of the vaccine mandate, we waited months and months and months before a vaccine mandate came. And then when the Texas court struck it down, they waited another 11 days before appealing after that. And that all was used against them to say, you don't really need a vaccine mandate.
Fascinating. Politico poll, which really surprised me. Do you support the CDC's extension of the federal travel mask mandate? 59% support, 32% oppose. Who knows how many of those people went on airplanes versus not. But how does the public's view or the court's simple view of the need for a mask mandate or how much the pandemic is raging inform them of how much leniency to give the government on this appeal?
You know, in theory, it shouldn't matter at all. You just read the law and you say, do you need this, or does this fit the law? But I think the government does have a more powerful argument when there's a real emergency. There really is something and we really need to do it. And judges tend to say, okay, I'm going to give you this leeway. But at this point, we are more than 2 years into the pandemic. There's no connection with wearing your mask in a small town bus stop and an interstate spread of COVID-19. So I think that same leeway that the government would have gotten at the beginning of the pandemic just isn't there when everyone at this point has been to an NFL game. They have been to a packed concert.
Yeah, and you can ask sort of where the rules start and stop and the CDC guidelines start and stop. Hey, this was a great conversation. Thank you. And when we figure out what happens in terms of what kind of appeal they do, we will be using your information. It's good to see you, May. Thanks as always.
Sounds great. Thank you.
Yeah, the politics of this and the science of this are intersecting in this sort of wild way.
Yeah, well, and the numbers, I don't know that they're all that surprising, but they do give us a glimpse into the public perspective of what is happening. You look at some of our polling today, support of new mask mandates in a surge, 64% support it. So you look at the cheering on planes, there's a big group of people who are still going to wear masks if necessary. And then those who support stay-at-home orders in a surge, 52%. Interestingly, and I spoke with the doctor earlier tonight, and I asked her the question, what does the traveling public make of this right now as our heads are kind of spinning around what to do? Here's what she said.
There isn't that much evidence that we need to do this right now, that we need masks on public transportation. Actually, people are wearing a bunch of different masks, and half of them don't work, half of them are cloth, half of them are falling off. And I think this is partially because they want the authority to put back public health measures when needed. I think it's a symbolic gesture.
Yeah, no, it makes a great point, and that is that a big part of the Biden administration's appealing on this is that they want to try to argue for the next call, right? They want to argue that if this comes back, that the CDC does indeed have this power, because there was a large thought that it was going to expire on May 3rd. What I think is interesting, and we've been covering this now for 2 years, right, is how in the very beginning, doctors universally said, this is something really to potentially be frightened of. And now doctors are sort of on every side of this issue in the same way that politicians are, in the same way that the general public is, that the interpretation of the science, if you will, has split substantially.
The one thing I will mention that the doctor and I spoke about was my question to her, because she tracks the hospitalizations. And I said, who's in the hospital right now? Is it the unvaccinated? You know, give me a real sense of the people who are getting the most sick. And she said it's two groups. One, it's the unvaccinated, healthy adults who haven't gotten the vaccine. And two, it's the immunocompromised. So she said, when you're trying to figure out what you need to be doing, if you're immunocompromised and you're more at risk, you should be wearing a mask when you're in public places, but it's the type of mask that you wear. It can't be down under your nose, around your chin. It can't just be a cloth mask. It has to be an N95. If you're going to travel on a plane and you're concerned about your own health, you have that choice to wear a mask. And for some people, it is important for their health. And for other people, it is important, the peace of mind that it gives them for their health. But that's where we're at. And looking to the federal government and to the CDC right now for answers. As she said, more of a symbolic gesture. It's been really confusing.
Yeah, no, picking up what you said about the unvaccinated who are the ones who are in the hospital, no question about that, because we know that if you have the vaccine, your chance of being hospitalized goes down into the 1,000th of 1%. Interestingly enough, it's the unvaccinated who, by an overwhelming majority, are against new mask mandates. The people who are most at risk are the most against the mandates.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.